Hello, everybody. My name is Marina Martinez-Kratz. I am a nursing professor from Jackson College, and I will be hosting this session. I would like to take a minute to introduce our speakers. So with us today is Amy Herrington. Amy's from Muskegon Community College. She's been an RN for 16 years. She has clinical experience in orthopedics, ER, surgical prep and recovery, and teaching experience in both med-surg and pediatrics. Amy's been teaching at Muskegon for 4 years. Heather VanderZanden, I'm sorry if I just slaughtered that. Heather has been an RN for 25 years. She has clinical experience in oncology, ER, and ICU, and teaching experience in med-surg and pediatrics. And she has been teaching at Muskegon for 9 years. And today they are going to cover Reimagining virtual clinical, which I'm sure we're all very interested since we've had to use this modality a lot, right, with the pandemic. So without further ado, I'm going to turn it over to them. Thank you.
Thank you. Okay, I am gonna pull up our screen to share. I'm Amy, this is Heather next to me. So as she stated, we're gonna talk about how we changed around virtual clinical. So our purpose is just to talk about different strategies that we can use to foster confidence in developing an effective virtual clinical experience while also incorporating hands-on practice. So we had been doing some virtual clinical with COVID coming, but then as we started to get feedback from students, we realized we were missing those hands-on portions. So that's where this came from. Objectives for today. At the conclusion of the webinar, the learner will be able to identify strategies that can be utilized in clinical lab days in the courses that you teach, and also examine how similar strategies could be used in your nursing program. So as I mentioned, COVID had some driving force in this, but we already had some limitations related to clinical space. I think a lot of people are experiencing that as well. Pediatrics opportunities is very limited to us here. Very rarely do we actually have peds inpatients, so our students don't get a lot of experience with that. They do get to see pediatric patients for outpatient surgery, and then we had community options for them prior to COVID, but since COVID has happened, we haven't had those opportunities. So they had been going to like the pediatric office,
Oak Ridge, the
schools,
health department,
ages and stages, like Head Start classes. But then since the pandemic, we haven't been able to get them back in there. So with that, we started doing virtual simulation, a program that we can do pediatric virtual clinicals through, which we had really great feedback with that. The students really enjoy those. But we're still missing a component. You know, they're coming to clinical and they're talking about how they haven't had hands-on in such a long time, missing those skills. So we started to look for another solution, and we had this aha moment of having clinical lab days. So this is just kind of a look at that program that we use for their virtual simulation. When we do the virtual simulations, we do try to mimic face-to-face clinical day as much as possible. So students log on at the start of their clinical time on Zoom, and we're together through that whole clinical day. We have a pre-conference. I attached, you can see like our virtual schedule. We have a pre-conference with them, and then depending on what their virtual simulation is going to be that day, we also have them do a concept map, and then we let them either work individually or in breakout rooms where they work on a concept map together for that day. So for example, the example we gave you was gastroenteritis and dehydration. So students work on that concept map just to become familiar prior to engaging in that simulation. We come back together and we discuss that concept map to kind of get them prepped for the simulation. And then they're able to work on that simulation while we stay on Zoom, and the clinical instructor is there to kind of guide them if they have questions. We can check in with them. pick their brain, kind of promote that higher order thinking, just as we would in clinical on site.
Amy, your slides aren't moving. I don't know if you can put it in slideshow format so that they progress for the audience to see.
Okay. Are we still, we're on the same?
We're still on Reimagining Virtual Clinical.
Oh, okay. Let me see. Can you see it now?
Yes.
Is it changing at all?
It is changing now. Yes.
Okay, just do that. Okay. Perfect. So then, we just go through, we meet with students individually, they do some breakout rooms together, and then we debrief at the end of the day, just as we would in normal clinical. So just trying to keep that normal face-to-face interaction going. So they have that collaboration and communication. So they're not just sent out on their own to do virtual by themselves.
A lot of times too, we would put them in their own individual breakout room when they were working individually on their case study. So that way, as faculty, we could log into their breakout room and we could meet with them one-on-one and discuss some areas that they may be struggling with, or answer any questions that they may have about the simulation scenario. Some students progress very rapidly through the scenarios. The scenarios were timed. We use Laravel pediatric vSim, and they were 20 minutes. They had a core and a complex patient. The core patient was just basic stable patient with gastroenteritis. The complex patient, the patient with gastroenteritis, presented the next day or presented in a different clinical setting and was more complex, got dehydrated, required a little more nursing interventions than maybe some of our basic first level students were prepared to do at that level. So when we first ran it, we didn't start with a concept map. So our first virtual clinical, we just did our pre-conference, had the students do the vSim, and then we met with the students individually, then we came back, we met as a group, we did post-conference. And then we were like, they're really not getting the whole piece of the information ahead of time because maybe they hadn't had it in theory yet. We hadn't really covered the GI stuff yet, lecture-wise. So then we decided, how can we get that information to them, or how can we have them all prep on this to be prepared to go in and take care of that patient, rather than just kind of sending them in the patient's room. I mean, in the clinical setting, we would expect that they would prep a little bit on that patient or have some baseline knowledge rather than just send them in kind of blinded.
Which I think actually turned out good because we had a nice discussion about the first day they went in blind and went right away to take care of the patient. They didn't explore the chart first, and most of them bombed it. And then the next time we had them prep, look at the chart, do their concept map, and they did so much better. So it was a nice reflection for them. It's really important that we're prepping ahead of time before going in and just tackling the patient right away. So we have that first day, because we have 2 days of clinical each week. Our first day, we do that simulation online, and then we decide to bring in a clinical day for the next day where they come to the lab. So these lab days, we focus on nurturing critical thinking, clinical reasoning, confidence, and practicing their skills. We had 7 stations set up. We kind of decided on 7 stations because that's just how it worked with the groups that we had, the size of groups. I think you could do it in any way, depending on what works for you. We try to focus each week on certain things. We always had medication administration, mini simulations, some sort of math, assessment. They do a case study where they practice a skill, other skill practice, and then a safety section. We're just going to go and take a look at those different examples of those different stations we did. So the first one was clinical and medication math. You have examples in this in the attachment that I sent out to be shared with you guys. So the math just has a huge range. The first week we really focused on the MAR and them identifying, like if they have to break a tab in half, insulin dosing, pediatric safe doses, that sort of thing. And then the following week, we looked at nutrition, just how much meal the patient has eaten, like 25%, 50%, because we were finding in clinical they were really struggling with that. Calculating I's and O's, calculating fluid requirements, expected urine outputs, that sort of thing with their math.
And one thing we also added on the MAR, it actually worked out. Our simulation tech that was putting in the information for our MAR, she actually entered an error with the insulin, and we left it like that. So we actually had an error on each one of our MARs for our students to see if they would catch it. And some students caught it and some students didn't. So we didn't totally make sure that everything was correct. We tried to put something in there to have that discussion of what would you do if you noticed this in the clinical setting as the nurse? How would you troubleshoot this problem? We had also had them fill out a medication error form as part of a safety one. So it kind of flowed together. We really debated at first if we wanted to add a medical error in there, a medicine error or not. And then after discussing, we're like, well, clinically, we've noticed that, the errors are in the MARs, or that the nurse has to identify those errors and troubleshoot those errors. So that worked out for a good discussion in debriefing.
Excuse me, Amy and Heather, could you put your presentation in slideshow format so it's larger? People are having trouble seeing it. It's just very small.
That's what I had earlier when the slides wouldn't move. I can try and we'll see if slides will move.
Can you try again? Yeah.
Is it showing in slide?
No, it's not. It's still, because it looks like you're in preview, because you have, because what we can see are your slides on the left side. So it doesn't look like maybe you're showing the wrong screen.
Okay, hold on just a minute. I wonder if I just make this smaller so you guys can see better, because I can't get it to switch over.
You can't get it to switch over. Is that
better?
It's a little better, but like the writing for me, and I'm old, so that's some of it, but I can't see any of that. I can see the title.
I didn't see, did our attachments get shared? Because all of this is in the attachment. We didn't share the PowerPoint, but the actual schedule and the lab packets were shared.
Okay.
I can make it bigger.
Oh yeah, that's great. Or if you have it in another, okay, that's better. Thank you. And I don't
for time-wise, I just didn't know if I can't get it figured out.
Yeah. Brenda says you'd have to stop sharing and then just start over with the correct screen, and it should work.
Okay. All right, so click out and stop share. Is it showing?
No, because we're not sharing the screen. How do I stay on this? Getting to that is what I'm saying.
Can you do slideshow?
I just feel like.
Okay. Can you see it now?
It's still going to be small though. Do you want me to keep going for time's sake, or do you want me to keep trying?
Go ahead and keep going. If one of you can just monitor the chat too, and I will. So if people aren't seeing the slides, it's just really hard to see. Thank you.
I didn't know to see the chat. I can email everybody the PowerPoint slides, but when I checked to see if this would work yesterday, nobody was on to be able to tell me if they could see my slides moving. So I assumed they were. Sorry about that. Okay, so another thing we did was like a room of errors. So this was our safety focus. So we just had a room set up with obviously many errors in there. They were kind of given, as you can see on the screen, an example of the patient. So you're caring for a 62-year-old woman. She was admitted for a small bowel obstruction, and it gave order. She was contact isolation for MRSA, but like there was no contact isolation sign up. There was no equipment out for that. Patient was NPO. There was food out. NG was to low intermittent suction. The suction wasn't set up correctly. She had a Foley catheter ordered. I'm sure there was something wrong with that.
We had that kinked.
Kinked, no stat lock. Oxygen was flowing at the wrong rate. There was all sorts of things. And then students had to write the safety issues they found and what they would do to resolve those issues. Each week we did mini simulations. We did 2 mini simulations. So they were about 10 minutes a piece. We did a peds mini sim and an adult mini sim. With the peds, we try to tie it in with the virtual simulation case we were doing that week. So this week, the example we gave you, we were focused on gastroenteritis and dehydration. So we had a child that had a tonsillectomy, or they could change it up. We gave freedom to the faculty member who was doing it. But essentially, the child was, that's not the good example. The child ended up dehydrated. And they were also diabetic, right? Because we had HAL, our HAL can have low blood sugar. So they had to identify what they would do for that. And then the adult, 1 week we did hypotension. We looked to see if they would, try to recheck the blood pressure. Would they get a manual blood pressure out? To check it manually, look and see what kind of interventions they're going to do to handle that. Any feedback about that, Heather?
Our course that we did was pediatrics and med surg. So we focused on some of the most common pediatric things that they would be seeing that semester, which they'll see like tonsillectomies, appies, asthmas. So we focused just on those. And then we did ortho and gastric bypass for our med surg because that's where clinically they were going to be at that semester.
And then they had a 5-minute debrief at the end of those, so the faculty member could discuss those things with the students. And then students were asked to reflect on their experience after that in their lab packet, focusing on what they felt went well, what their biggest takeaway was from that simulation, what they might do differently next time. And then a big one, how are they going to use what they learned when they go to clinical in a couple weeks? A big thing we hear is skills. So our students have practice labs where they come in and practice their skills for the semester. They have test outs, but we know that limited exposure is just not enough. They need to be exposed more and more. So we looked at our skills for the semester and then developed case studies to go with those skills. So we had a case study that's in the packet we provided you. Is a small bowel obstruction. And so the focus was NG maintenance for those students. So they're working through the case study and then they get to a certain point where they realize the NG is not working. So they need to go through and check NG placement, check the suction equipment and make sure it's working appropriately. Another week we did a urinary case study and they had to do a catheter insertion. So they're getting the time to be able to practice those skills again and get hands-on like they would in the clinical setting while also having to look at the reasoning behind it and do those case studies. Okay, so physical assessment, they had a physical assessment each week as well. With this, their peer, because they always work in pairs, their peer is going to be peer evaluating them and giving them feedback. So we know a lot of times the students have a hard time like evaluating without prompts, right? Because they only know what they know, but we don't have enough faculty members to be in each of these stations. So one faculty member does round while the other faculty member is working the mini simulation. So what we did is come up with a bunch of different scenarios. I have one on the PowerPoint here. I'll try to make it bigger so you guys can see it, that the student can pick out and their peer reads it to them and essentially gives them a little bit of a report. Like 54-year-old male patient, he had a TLIF, he's post-op day number 2. His incision's open to air. He's got a JB drain to bulb suction and has a history of obesity and smoking. So the peer gives the student who's actually going to do the assessment that tiny little report that's supposed to guide that student to decide what's going to be important to assess on this patient. And then we kept the evaluator guide there for the peer who's evaluating the student who's doing the assessment so they can give some direction and know what that student should be looking for. And then I think we probably had like 10 different scenarios, so they would pick that out so that they weren't just going in and doing a plain head-to-toe assessment. Because I'm sure what you guys see and we see in clinical is a student gets there and they're like, am I going to do a full head-to-toe assessment? So trying to really get them to hone in on what is going on with this patient and what's important.
In the assessment tool they used as their peer evaluator was the same assessment tool that we use clinically to evaluate our students' physical assessment. So it allowed them the opportunity to be evaluated by a peer before faculty evaluated them on their physical assessment in the clinical setting.
All right, in medication administration, Heather touched on this a little bit already with the medication errors. So the MAR that they used to do their medication math is the same MAR that they used the first week for their medication administration practice. We do have a barcode scanning system in MAR that they're able to practice with. Again, with this in their peer group, they're peer evaluated. And they're using the medication administration evaluation form that they use in the semester before this when they do their skill test out for medication administration. So like I mentioned, the students use that MAR that's in the front of the packet. Each student has 15 minutes to give the medications. We give them a sample blood pressure as well as heart rate, and then also blood glucose readings so they can figure out how much insulin they have to give, whether they want to give certain medications.
We included a beta blocker. One time we included a blood pressure that was low, so they would have to know that it was not within the order parameters, so that med would be held. We focused on sub-Qs, IMs, and oral medications. The students at the level that we are at in the course did not have IV medications or were at the level where they could give IV stuff. So it just focused on just the oral sub-Qs and IMs.
Injections is a station we also did. We find that our students are never quite as comfortable as they would like to be and we would like them to be for injections. For us, they learn about injections a semester before they come to this course. So they do need just a little bit more exposure to that. So with this in their packet, they do have a worksheet that guides them through. With that, they are looking at like which subcutaneous sites they can use, which IM sites, identifying those sites so they can identify on each other. But we also have our mannequins available so they can practice those landmarks and actually see them on the mannequins. They're the mannequins, I don't know what they're called. They're site marker mannequins. That's what they're made for, so that they can actually see and feel those sites. They focus on their techniques, needle sizes, max volume, mixing of insulin in the proper way to do that, because that's something they learned the semester before, but don't do a lot in clinical anymore. So just focusing on those things that they don't get a ton of exposure to, that they need more practice with. And one other site that we did was manual blood pressures, the actual Vitas machine too, and then also using our heart and lung sounds for students to practice those assessment skills, and hear those sort of heart and lung sounds that they don't always get to hear or recognize they're hearing. So just more practice with hearing those different heart sounds, lung sounds, and practicing manual blood pressures. We find a lot of students struggle with that. So giving them more opportunity to practice that is ideal for them.
We wanted to make sure too, because they're taking care of the post-op patients, and if they had post-op hypotension, that they would feel comfortable getting a lower blood pressure on a patient.
So those are examples of some of the different stations we used. We do have more examples if you want those. You're free to email us, and I'd be happy to share. We're next going to look at our student feedback. We had wonderful student feedback. I don't know that we had any negative feedback on this experience. Students really enjoyed being able to come into the lab. So the first thing was, how would you rate the clinical simulation experience? That's referring to our clinical lab days. And as you can see, there were no negatives, not even any fares. It was mostly very good and excellent. How beneficial was clinical sim in preparing you for real agency clinical? Again, like all positive remarks there. Students, just students talking to us, they had so many positive things to say about it. It definitely made them feel much more confident and more prepared to go into clinical. How was a clin simulation student workbook packet? Was that helpful or useful? Again, they were very positive feedback on that. We took these back from them just to review them to make sure students were on the right path with their simulations and their answers. But students wanted them back, so we did give them back to them. They wanted to be able to utilize those. And then the best part of clinical sim experience for me, I just put a word cloud in there so you could see the main words that came out of there, because that was a free form for them. And then just some reflection, because our students do weekly reflections. These were some of the reflections we got back from students. I don't know how well you guys can read those. Well, I really enjoyed doing the sim lab, and I felt like it refreshed my memory. It was
It looks like we lost them. Thank you, everyone, for your patience. I'm sorry for all the problems we're having. Hopefully, they're able to get this back online. Please, if you get a chance, visit the exhibitors today. And I'll follow up and see if I can get those attachments that they had sent in, and see if we can get those dispersed out to everyone also.
I don't know what happened.
That's okay. It's all right. We can see you now. We can see you now.
Okay. How long were we gone?
Just a couple minutes.
Oh, what is the last thing how long were we talking without someone hearing?
You had your PowerPoint up and you were going over the feedback from the students. I did get a tip though from Motown Digital, and they said if you click on the reader mode on the bottom of your PowerPoint, that may make it bigger and easier to read for everyone.
Okay.
So that's where you were.
Well,
You're done?
We're done with that. We just have a quick, we won't watch it all. We have a YouTube video that they made for us that we just want to show just of what that clinical looked like.
Awesome.
Some sound, so maybe we can view it and answer questions as people.
Yeah, you're breaking up again.
I can't turn the screen down better. I want to show that. Maybe I just maybe I'll just paste it in the chat. I'm going to paste that YouTube video into the chat. Can you hear me or no?
Yes, I can hear you. You're just breaking up a little bit, but I think that's a great idea. I see it there. It's in the chat.
Okay. Does anyone have questions or ideas that they use that they want to share? We love to just network and hear what other people are doing.
Somebody said they're doing weekly reflections.
We do that too. We do that as part of, they do weekly journals and weekly journal reflections and goals as well. That's good. That's good.
Motown Digital says, would you like them to play the video? They can play the video for you.
I don't know. If people have questions and talking, we could do that because they can watch the video anytime if they want to copy and paste that in to give them kind of an idea.
Okay.
How do you manage grouping? That was tricky for us. That's probably like only negative feedback we got from students was that they would like to see more faculty members there. So because it was just two, we combined two clinical groups. So we would have 2 faculty members there with the 2 clinical groups.
We had 16 to 18 students and 2 faculty.
So one faculty member was doing the mini sims while the other faculty member was like rounding, keeping time, answering questions, asking the students questions to keep them thinking. Ideally, it would be wonderful if we can have more, but as you guys know, staffing is always still. So we really had to utilize that like peer evaluation.
So Sheila, do you guys use where you draw from hat type skill at the end of the semester for the round robin review? Do they test out individually on those skills and then just do it as a review?
I wish everybody could talk now. That would make it easier. Write that down. That's a good idea.
So that's the skill.
The round robin. Sheila said that they do a sim and at the end of the semester they do the round robin. Sheila, if you want to add your audio, you could come in and talk to that if you want to. At the bottom, well, at the bottom of my screen, I don't know if everybody has that availability. There's a microphone. Oh, he says the share audio and video button.
Let me see if I can find it.
Top right.
I'm going to put my email in the chat. So if you want to see the packets, you can email me and I can send them to you. I'm not sure why they weren't dispersed. Maybe I sent them out too late. Thank you, Sheila. Marina, do you know for the round table, can everybody have you and talk, or is that done through chat?
I don't know. I think you're going to be able to. I think everybody's going to be able to chat. If I remember
because this is hard to keep a conversation flow.
It really is, and it's not matching up my 10-minute training yesterday.
Right. Okay.
What I'm seeing, so I know I'm getting anxious about my own presentation tomorrow. You guys did a great job. Don't worry about the tech. I mean, it's what happens. I'll follow up on those attachments too and see if we can just get them emailed out to everybody. But nice job.
Thank you.
Thank you for your patience.
Thanks everybody for coming. Feel free to email me if you have more questions.